Imagine it's early evening. You've finished dinner. The TV is on. The house is quiet. Like you have done hundreds of times before, you take your blood pressure medication. Maybe it's Amlodipine. Maybe you've taken it for months or years. Your blood pressure has improved. Your doctor is pleased. Because you've taken this little tablet so often, you barely think about it anymore. Then something happens. You feel pressure in the center of your chest. Not crushing, just strange. A few minutes later you feel slightly dizzy. Immediately one thought enters your mind. It must be my medication. That thought is understandable. But in some situations it can be the most dangerous assumption you make that day. Amlodipine can cause side effects. But a person taking blood pressure medicine can also be having a heart attack, an abnormal heart rhythm, dangerously low blood pressure, or another emergency. When you are over 60, knowing which symptoms you should never simply blame on the medication is especially important. In this video, I'll show you 5 warning signs that deserve attention. After number 5, I'll give a simple emergency sequence to remember if one of these symptoms happens while you are alone. There's also one common mistake at the end. People check their blood pressure repeatedly and waste the minutes they should be getting help. Stay with me. This isn't about making you afraid of amlodipine. Amlodipine is widely used and helps many people by relaxing blood vessels and lowering blood pressure. This video is about knowing when not to blame your medication. Amlodipine commonly causes ankle or leg swelling, dizziness, flushing, tiredness, and sometimes noticeable heartbeats. But more severe or worsening chest pain, fainting, or a rapid or irregular heartbeat can require urgent attention. If you are experiencing possible heart attack symptoms right now, do not finish this video. Contact your local emergency medical service now. This video cannot diagnose chest pain, and no online video should be used to decide whether a suspected heart attack can wait. Warning sign number 1. Chest pressure you have never felt before. People often imagine a dramatic, sudden collapse when they think of a heart attack. Real life does not always look like that. A heart attack can begin with mild discomfort. Pressure, squeezing, fullness, heaviness, burning, or a strange central chest feeling that comes and goes. If you are over 60 and take amlodipine, you might rationalize unusual sensations as medication effects. That shortcut can be dangerous when the symptom is new. A home blood pressure reading cannot rule out a heart attack. Mild pain does not mean safe. Ask yourself, is this new, unexplained, persistent, or concerning? If chest pressure comes with sweating, nausea, breathlessness, weakness, or discomfort elsewhere in the upper body, seek urgent evaluation. Do not press on your chest to diagnose it. Do not spend 20 minutes searching symptoms online. And do not take an extra blood pressure tablet hoping it will treat a suspected heart attack. Your daily tablet is not a rescue treatment. Warning sign number 2. Breathlessness that does not make sense. You are sitting, not climbing stairs, not carrying groceries, but suddenly breathing feels harder. Maybe you can still speak, but you are taking deeper breaths or can't get enough air. The dangerous responses are, I'm getting older, I'm anxious, or, the pill made me weak. Unexplained shortness of breath can be a sign of a heart attack and can occur with or without chest discomfort. Women may have nausea, unusual tiredness, weakness, stomach discomfort, or breathlessness as prominent symptoms. If your breathing suddenly changes without explanation, especially with chest discomfort, sweating, nausea, faintness, or upper body discomfort, call emergency services. Do not drive yourself if an ambulance or a safe option is available. Emergency personnel can begin evaluation and treatment before you reach the hospital. Warning sign number 3. Pain that travels away from the chest. Heart-related discomfort can appear in one or both arms, the back, the neck, the jaw, or the upper abdomen. People over 60 commonly have aches from arthritis, stiff necks, or occasional indigestion, so a new cardiac symptom can be misattributed to an existing problem. If jaw, arm, back, shoulder, or stomach discomfort appears suddenly together with chest pressure, breathlessness, nausea, sweating, dizziness, or weakness, do not dismiss it because one symptom has happened before. Think in patterns. Several concerning symptoms together deserve attention. Either arm can be involved. The back, jaw, or stomach can be involved. Don't wait for the TV version of a heart attack. Warning sign number 4. Dizziness, near fainting, or actual fainting. Amlodipine can cause mild dizziness for some people. Standing up and feeling lightheaded briefly is different from suddenly feeling the room vanish. being unable to remain upright, having a pounding or irregular heart, chest pressure, or losing consciousness. Fainting and rapid irregular heartbeat are among the amlodipine-related symptoms that warrant immediate medical attention. If dizziness appears with suspected heart attack symptoms, it's even more urgent. If this happens while you are alone, prioritize safety. Sit or lie down in a safe position. Keep your phone with you and use speaker mode if needed. Follow the dispatcher's instructions. Do not wander around the house trying to solve the problem. Do not take an extra dose of amlodipine because you think your blood pressure is high. You cannot determine the cause of severe dizziness from the feeling alone, and taking extra medication can make things worse. Script 11. Warning sign number 5. A rapid or irregular heartbeat with other symptoms. Most people have felt their heart race after exercise, caffeine, or anxiety. A noticeable heartbeat alone doesn't automatically mean emergency. Context matters. If your heart suddenly begins pounding or racing and at the same time you feel faint, short of breath, or develop chest pressure, weakness, or confusion, that needs medical attention. Rapid or irregular heartbeat with concerning symptoms can be part of a serious cardiovascular event. Don't spend 15 minutes trying to count every heartbeat. Don't delay help while you obsess over perfect numbers. Numbers are useful, but during a possible emergency, they must not become procrastination. Now, the alone-at-home emergency sequence. First, contact your local emergency medical service immediately. Do this before searching online, before calling relatives, before showering, before trying to sleep it off, and before waiting to see if the symptom becomes dramatic enough to deserve an ambulance. The American Heart Association advises people to seek emergency help even when they are not sure the symptoms represent a heart attack. Put the phone on speaker if that helps. State your location clearly. Tell the dispatcher you are alone. Describe your symptoms simply. For example, I am 72 years old. I have new pressure in my chest and I feel short of breath. I am alone at home. That sentence is far more useful than self-diagnosis. Let the professionals ask questions. Second, reduce unnecessary physical movement. Sit or lie somewhere safe. If you feel faint, do not walk around unnecessarily. Don't tidy the room, gather multiple items, or walk outside to ask a neighbor for help. Unless emergency professionals tell you otherwise, don't attempt to drive yourself when emergency transport is available. Third, follow the dispatcher's instructions. Every person's history, medications, and allergies differ. Some people have prescribed emergency medications for known heart disease. Others do not. Do not borrow someone else's medication. Do not take an extra amlodipine tablet. Do not take a random heart medication that belonged to a spouse. Do not improvise treatments you saw on social media. Finally, avoid the common mistake that wastes time, repeatedly checking blood pressure or pulse until you get the right number. Don't let monitoring become procrastination. If you have new, unexplained chest pressure, breathlessness, fainting, or a rapid or irregular heartbeat with other symptoms, call for help first. Your prescribed dose is not something to improvise during an emergency. Amlodipine helps many people live healthier lives. But when you are over 60 and you experience new, unexplained chest pressure, breathlessness, pain that travels away from the chest, dizziness or fainting, or a rapid or irregular heartbeat with other symptoms, do not automatically blame the pill. Treat those signs as potentially serious and seek emergency evaluation promptly.